Dengue fever, a mosquito-borne disease that mostly affects people in tropical and subtropical regions, causes fever and muscle and joint aches. Its impact can be fatal. The tropical disease has almost been an annual phenomenon in India capital New Delhi, where the death toll has risen to 9 until Tuesday. More than 1,800 cases of infections have been reported, with 600 last week alone. It's reported that this is the worst outbreak of dengue in Delhi since 2010. Hospitals are overcrowded as patients are outpouring the available facilities as part of the efforts to control the situation. Delhi government has cancelled vacations for hospital staff. For 40-year-old Rita Mishra, she wasn't even aware of the disease when she was infected, until she was advised to take further examination in hospital as her blood platelet counts showed a sharp decrease compared to the normal level.
We don't know about anything else. She is suffering from dengue fever, and that we came to know from her medical report that she has been inflicted with dengue.
The Indian capital region is witnessing one of the worst dengue crises in recent years, as the number of infections continue to rise each day. 9 lives have been claimed so far in Delhi. About 1,872 cases have been reported till September 12th, and 613 cases last week alone. The hospital authorities are struggling hard to match the rising number of patients with the limited resources available. A couple committed suicide by jumping from the building of their rented house after their 7-year-old son died of the disease last week. In their suicide note, the couple held hospitals responsible for the demise of their only kid, as a number of hospitals had refused to admit their child due to the shortage of beds. In response to the tragedy, the Delhi government and leaders of ruling party claimed to adopt all measures to prevent such tragedy from happening again.
Government has given an instruction strictly to all the hospitals, whether it is a private or government. Everybody has to take care of this situation. Anybody will do the same thing. The inquiry is going on that case also, and anybody will do this thing. He will be not forgiven for this thing, because every citizen, his life is important for the country as well as for the government.
Deen Dayal Hospital, one of the largest state-run hospitals, has 640 beds. However, the authorities have admitted over 800 patients, accommodating 2 or more patients on a single bed, and patients are being treated in lobbies and corridors. All other premises at hospitals, including the operation theaters and intensive care units, have been converted into emergency wards for dengue patients.
We are trying to accommodate by increasing total number of bed, by maybe doubling, or नेक्स्ट जो हमने स्टेप लिया है, जो खाली बेड जैसे डिजास्टर के लिए रखे हुए थे उनको ले लिया, कुछ ऑर्थो की इलेक्टिव सर्जरी रुकवा दी गई ऑलरेडी, उनके बेड हमने उनको कन्वर्ट कर दिए.
Dengue fever, also known as breakbone fever, is a communicable disease transmitted by female Aedes mosquitoes. The disease usually comes up during and just after the rainy season, normally lasts from June to September.
मॉस्किटो साइकिल इज लाइक दैट, ब्रीडिंग एंड इस समय पीक पे होता है. इट्स ऑलवेज एट पीक इन द मंथ ऑफ सितंबर और अक्टूबर तक जाएगा. अब मतलब पीक भी आई विल से स्टेबलाइज हो गया है, एक जो सडन सर्ज आया था, तो साइकिल इस तरह का है. और नाउ इट विल गो डाउन ओनली व्हेन टेम्परेचर फॉल्स. थोड़ा रहेगा अभी, वी आर एक्सपेक्टिंग मे बी फॉर अ मंथ और सो अभी रहेगा डेंगू का.
The dengue virus has killed millions of people around the globe since the Second World War. It has also been declared as endemic in over 100 countries, including India. According to the official data, around 20,000 dengue cases are reported every year in India, and the deadly virus costs over $1.1 billion each year.